Oh, that is absolutely... Oh! Hello, beautifuls. Welcome back to my Chanel. And welcome to another episode of Botched, girls.
Time for a brow lift.
Are you sitting comfortably? Do you want to wear mummy's wig? Are you ready for your brow lift? Welcome back to the Chanel, my lovelies. It's been a little while since I've sat down and filmed, actually, because I've been pre-filming a lot recently to maneuver some things behind the scenes, shall we say. Big announcement coming soon. Oh my God, stay tuned. Watch this space. Blah. It's not actually that big. Well, I guess it is. It's more like a personal thing.
That bitch is giving me gout.
So, my lovelies, you guys are loving this series here on the Chanel. Botched! It was requested for years and years and years. And I hadn't really worked out a way that I was comfortable to do it in such a well-rounded and copyright-friendly way, shall we say. Now, if you are sitting here watching this show with me on the Chanel, my lovelies, you will notice I have to, hang on this hand, I have to rotate the footage ever so slightly, and that is because that transforms the footage enough for it to not be considered copyright infringement here on YouTube. Just so you know, my lovelies. Just so you know. I'm kind of skipping one or two episodes here and there because unfortunately, as is the nature of sometimes problematic plastic surgery ventures, shall we say, people pass away. And I don't really want to include the episodes in which they've passed away. Just gonna say that there. So we're skipping ahead an episode today. We are still in season 1 of Botched, which I still can't believe came out in like 2014 because to me, it's like an old show. I mean, I guess that is like 10 years old. But that's neither here nor there, my lovelies. Would you like a top comment from the last episode of Botched, my loves? Because I know I do. Hang on. How does the telephone? Oh, that's a very handsome photo of my boyfriend. Which one's that? Oh, isn't he pretty? The top comment on the last episode of Botched, my loves, is by Tracy Jane 7724, and they say, I'm completely shocked at the statement, men don't have breast tissue. Men can get breast cancer, and it's hard enough to get them to check themselves and go to the doctor without professionals on the TV telling them that they don't have breast tissue. Medical misinformation can be so dangerous. Yes, it can be, my loves. Yes, it can. In the last episode, it featured prominently a trans woman's experience going under plastic surgery, especially for breast tissue, and Dr. Dubrow said something remarkably obscene, being like, men don't have breast tissue, so there wasn't anything there. It's just not true. It's transphobic, but it's also just not true. Everyone on the planet at some point in their life should check their breast tissue. Just gonna leave it out there. With that being said, my loves, are you ready to sit down with me today? Grab yourself a little beverage. I'm once again on a caffeinated beverage because she needs the energy. Pop your little hanger right into your... Are we going with botched hole? We need a voting system for this, don't we? Botched hole? Is it in your botched hole? Hand me the forceps and prepare for surgery. It's time for botched.
My wife is a transsexual Satan worshiper.
I want to be sexy. I want to be perfect. Are you ready for the MySpace song, girlies? It's so nostalgic to me because this is literally like MySpace era. Even the graphics are kind of MySpace. The music's MySpace. The imagery is very MySpace. Wasn't that an easier time when social media wasn't just about like the most hateful takes on humanity you could possibly ever hear or read? Truly, we're in the era of it is the worst time in human history to have eyes.
She's psychic.
Botched, girls! I want to be perfect.
Hey, it's your girl Saaphyri. You might know me from some reality shows. Blah, blah, blah.
Reality rock
Charm
star.
School. Hollin' in the Hood. I love
Charm School. People have been telling me to react to Charm School. Should I react to Charm School?
Charm School. Hollin' in the Hood. I Love Money season 2. I
Love
broke into
Money.
reality. I became famous from that. But when you're a television personality, you're judged way more harsher than the average person. They will chop you down, cut you up, put you in a freezer, and bring you out the next day to finish talking about you.
Oh, goodness
Yeah,
me.
it was
Oh,
hurtful.
what great
So
lashes.
I worked really hard. I lost a lot of weight, and my breasts, they deflated basically because there wasn't no meat to keep them up. And then it was like, even though I lost weight, my stomach never lost weight. So I was like, well, if I get some liposuction here and plumping these up here, you know, then I'll look perfect, like a, you know, little chocolate Barbie. And I had did the skinny part on my own, so I figured, why not go ahead and get the rest of my hotness from the doctor?
Okay, so we've got actually quite an interesting, compelling story here because that's kind of an aspect of a weight loss or weight management journey that isn't really spoken about, is that sometimes an area of your body, although it can change, or in this case it can shrink, sometimes it's just not the same as it was before, shall we say that? So then surgical intervention is kind of your only option. Interesting. We don't ever go through that. On the weight management journey shows here on the Chanel, my lovelies, we don't often go into that. So interesting. My problem area from my weight loss journey is these little bits under here. Whenever I'm wearing something that's just a little bit tighter than usual, I'm like, lovely. Labia majora of the armpit.
Labia?
Went to this doctor because my cousin was like, oh, he's bomb, he's new girl, he ain't gonna charge you a lot,
Of course,
thinking it's gonna be good. After the surgery was done, he put this girdle on me. It had a piece of wire in it. It made an indentation in my stomach that just never went away. And then my breasts, I didn't think they were gonna be so huge. Then I gained weight and they started flopping around like some grandmamas, and I wanted to wake up with a new me. I woke up with somebody else like in my breast, like a midget was living in my breast.
Mark?
Okay, I mean, 10 years ago was a different time, but still, we're not going to use a word like that. And I also don't feel it would be appropriate to be like, I woke up with a little person in my breasts.
What the is going on in here on this day?
Do you know, there are some times in life where you wake up in the morning on a day and you think, I wonder what absolute unhinged sentence I'm going to hear today, because there is not a single person on this planet that could have told me I was going to say that sentence today.
This is Saaphyri.
Great to meet you.
So nice to meet you.
Talent management.
Do you want water or anything?
Yes,
Demon
everything.
twink.
We're a talent management company, represent actors, writers.
Stop! No! Okay, disgusting story time. I was picking my, like, residue of, like, a gel nail off, and I cleaned it off my table the other day, but I put a piece here, and I must have forgotten about it. I've just moved something, and it, like, scurried across the table and gave me an absolute fright, darlings. Oh, unhinged. Right, sorry. Mark, the talent lady, is going to give his opinion on surgery, I'm guessing.
Management company, represent actors, writers, directors, hosts.
I'm like well aware. I've written some things and brought you a couple of treatments. I don't know if I'm eccentric or, you know, what have you, but I see things a little bit differently. But now I'm branching out. You know, I write, I create. I want to host it. I want to star in it, everything. I want to be that bitch.
Oh, do you want to be
to
that
actually
bitch?
have my idea.
Oh, he has the face of like, I'm entertaining what you're saying, but once you leave the store, I will never call you again. I have had that face pulled at me multiple times. Have you, my love?
Actually have my idea permeate the screen,
alarmingly like
you
my
know,
ex.
and just let everyone see what I'm thinking inside of here. I need to have my breast be professional breasts, not stripper breasts. I don't want
Professional
everyone
breasts.
to just stare down at my chest. I want them to look me in my eye for my own self. So I have that personal confidence.
Is professional, is the word professional synonymous with like small? There was that hateful tweet recently that was like, do you like voluptuous breasts or are you a tiny aristocratic breast man? And I was like, oh, what is that? Why is this a conversation? Can we just not? Why is one scene inherently professional and the other is like, oh.
Back alley, bitch.
Kind of like a guy who likes to wear women's underwear. He knows what's on underneath there. Nobody else does. That's what I want.
Pleasure to meet you.
Pleasure to meet you as well. Saaphyri is that boss, bitch.
Okay. All right, a very interesting anecdote, but you know what? The Facebook crozzies are going wild, girls.
We're seeing someone named Sapphire?
Dr. Paul.
Saaphyri?
Saaphyri.
Dr. Terry
Saaphyri.
Saaphyri, she's a reality star.
Good day, Dr. Nassif, Dr. Dubrow. Here's Saaphyri.
Oh, I like
How
her
are you?
jacket.
Nice
Oh, yeah, very
meeting you.
edgy
Dr.
woman on the
Nassif.
game.
Nice meeting you,
How are
Dr.
you?
Nassif.
Terry
Good
Dubrow.
evening. Good. Oh, yeah, that jacket, yes. Isn't it interesting how, like, punk counterculture is very widely adopted now? Like, do you remember back in the day where, like, a biker jacket was like, oh, don't wear a biker jacket, but now we can see them being worn on TV, although this was 10 years ago. So maybe she's just a fashionista ahead of the time. Love it.
All right, well, tell us a little bit about what has gone on with you plastic surgery-wise.
Right, yes.
A few years ago, I lost a lot of weight.
So how did you lose that weight?
I did like this 3-day diet where you just eat ice cream at night and you eat the other foods during the day.
The ice cream diet.
Kinda.
No, I don't know.
I've never heard of that.
The
I
ice
like
cream-
that ice cream diet. I think I want to get on that.
Tell us about the surgery you had and your experience with the doctor.
It was really spooky. I remember I woke up on the table and I felt pain.
So you woke up during surgery.
I woke up during surgery. I said something to
Oh,
him.
that is absolutely... we hear horror stories quite often. If you're ever a frequent in like surgery subreddits, like plastic surgery subreddits over on Reddit, I like to lurk over there. I like to browse what people have to say. I like to browse people's results and what they're considering having done. I like to watch. I like to see. I like to peep.
I don't know if you're a detective or a pervert.
It is kind of alarming the amount of times you read a story of someone saying they woke up during surgery.
And he actually told me to be quiet. I'm like, ow. And he was like, shut up. And I was like, huh? And so then I seen the anesthesiologist put something else in, so it made me doze off. I was still mad. Like, he told me to shut up. There was one patient, and he didn't even take her to the hospital. He took her to his home. She actually died at his home. It was like on the news and everything. Her
You need to
family was,
name
like,
and
really upset about
shame.
that. So I guess he probably did that to someone else as well, and they killed him at a Frosty Freeze here in Los Angeles.
They killed him.
Yeah, he was murdered.
Wait, Frosty Freeze, don't they have ice cream there?
Yeah, they have ice.
I'm sorry, what are we hearing?
Her family was like really upset about that. So I guess he probably did that to someone else as well, and they killed him at a Frosty Freeze here in Los Angeles.
Right,
killed
so the
him.
doctor
Yeah, he
is
was
dead?
murdered.
Wait, Frosty Freeze, don't they have
Goodness
ice
me,
cream
what
there?
a circle of, I don't even know what, a circle of feces.
They have ice cream
He's
at
trying to
Frosty
follow your
Freeze.
diet.
You weren't on the ice cream diet that time, were you?
Oh gosh, it's the
Oh,
missing link, the ice
no.
cream.
So,
Are you trying to
Fiery,
say something?
Wait a minute. I feel trapped.
there'll be no ice cream post-op for her.
He was murdered,
Oh,
we
ice
think, by a
cream's quite
patient?
nice when you're feeling a bit shitty after surgery, though. You're just like, little bit of ice cream. Although saying that, I had a Lindor earlier, and now I'm like dying of nausea. Do you ever have that? Just sometimes. Sometimes you choose to have something sweet, and your body's like, do you know what? You've made a mistake.
I think he was murdered by a patient. I plead the fifth. I don't even want to talk about him no more. No, I was nowhere
Yes,
near
this is
that
all like
at
speculaciones.
All right, so let's start with the chest, then we'll move to the stomach,
Oh,
yes?
okay, right. Booby time.
You have a lot of breast tissue, your
Yeah.
own natural breast tissue, right?
Yeah.
So you actually have to cut into around here to reduce the areola.
Is it a breast
Oh,
lift?
you were reading my mind.
Oh.
You were reading my mind. I swear he was reading my mind. Wasn't he reading my mind? Remember I told you just the other day I said I want my areola to be littler and cuter buttonier.
Button here?
Yeah, like cute as a button.
Her breasts are
An
far too
areola
big for
reduction?
her body.
I'm sure we saw her on tour recently, didn't we?
Her breasts are far too big for her body, and her breasts need to be lifted significantly.
I'm not
So
sure I
with the
like that
stomach.
phrasing.
So this is where that garment cut into you.
Right.
This is really more about loose skin than it really is about the lumpiness. Your abdomen is a little full like this.
Is it because I just ate that steak burrito?
It could be. This is going to be a difficult case because liposuction alone will probably just make her worse.
Right,
She's going to
so-
have to do a tummy tuck.
tummy tuck.
And have that big hip-to-hip scar. Here,
Oh my goodness, a tummy tuck and a breast lift at the same time, same surgery. All of this is you're gonna be sore from asshole to appetite.
Excuse me, bitch!
Don't say that, Luxeria. You're gonna be sore from the neck down, shall we say. Oh dear.
all the way across to here.
yes.
Pull the excess
tummy tuck
down.
is a
And do
considerable
some liposuction up
undertaking.
here because it's still too full.
Yes.
That's a tummy tuck, and it's the fix for your problem.
Okay,
I mean,
well,
if we do this and I give
he's
you
been
scars,
quite
I just want to
realistic,
make
though.
sure, you know, if I'm in an ice cream store, then all of a sudden I look over my shoulder and you're not standing there, right?
I don't know. I might have a craving for ice cream.
Ice cream
With
murderers.
my new boobies and my new stomach, not only am I going to take the world by storm, they might even call me Storm because I'm going to be a bad... Shut your mouth.
Oh, she's got a woman on the go. Is this akin to something that we would now know as a mummy makeover? Is that this kind of surgery? I'm pretty sure. Like, what's in a mummy makeover? Should we have a little look-see? A mummy makeover is a combination of procedures typically involving breast and abdominal surgery. There we go. Okay, so this is now what we would know as a mummy makeover. Would you like to wear mummy's wig?
Hello, darling.
Oh.
My name is Adam Apodaca, aka Venus Delight, and I am the #1 Madonna impersonator in the world. I perform
yes.
all over the United States, and I've even been in the Caribbean.
Venus Delight?
I'm known as the Madonna who had plastic surgery to look like Madonna. I've gotten mistaken many times for Madonna. Even at her last concert, I was taking photographs in the front. They thought it was real Madonna, actually just standing out front taking pictures with people. And then I talked to them, they're like, oh, wait, you're not Madonna.
No, you are not Madonna. There is something very interesting about the world of impersonation, shall we say, like celebrity impersonation, to the point where you start to get work done to resemble that person, that celebrity. We saw this a little while ago. In fact, actually, it's probably many, many, many years ago now. It was called I Want a Famous Face, and it was a very brief MTV plastic surgery show that followed celebrity impersonators as they get surgery to look like their celebrity counterparts. And there was a guy on there that tried to look like Elvis, and it was just a very alarming and, in my opinion, unethical journey to undergo, like unethical for a surgeon to indulge. I'm not sure. Right, so let's hear more about Adam's story, shall we?
When I was 15 years old, Madonna's Ray of Light album came out.
Right.
And I was so infatuated with it. I told my mom that when I grow up, I want to be Madonna.
Okay.
And she thought I was crazy. So I said, okay, well, one day I will prove you wrong.
Right, okay.
I started doing drag in 2002. I was very nervous if I could look like her or not. But my ex-boyfriend had makeup skills, and he made me the queen of pop.
Okay.
I've had 7 procedures in the last 6 years to look like Madonna.
Oh.
I had my...
Isn't that a very interestingly alarming sentence to hear anyone say? I have had 7 procedures to look like blah de blah.
I had my cheeks implanted.
Has Madonna ever looked like this? And I don't mean to be like really awful and mean, but like, has Madonna, this is the thing with like celebrity impersonators, have they ever actually looked like this? Like, one of the only examples I can really think of where it's like almost a double take was Derek Barry on, was it X Factor or America's Got Talent or Britain's Got Talent? One of them. And it was literally like, but like, I feel like the window of resembling someone is quite small. And then forever as you get older and that celebrity's popularity wanes, you're chasing a golden era. I don't know. To me, it doesn't sound like a well-adjusted, adult, considered mind. Just gonna leave that there.
I had my cheeks implanted, so when I smile, I get this little love buttons right here of a smile that she has. And for my chin, I had a full implant. And then I got my jaw done. The photos that were taken after that, I really looked in them and I said, wow, I really look like her. I would really like my nose done. I really would like to get rid of this bump right here. It gives me this Barbra Streisand profile. And I don't do Streisand. And also, if there's a chance...
You shouldn't get a nose job because you want to resemble a celebrity. You should get a nose job because you want that nose job. That's my opinion anyway.
Maybe flare up my nostrils as well, because usually I put eyeshadow on them to give this little flared look. I'm at a point in my career where I just need a new nose. I want to be the #1 Madonna impersonator, and I will do anything it takes to get there.
Right, okay. Unfortunately, Adam here, Venus Delight, has been the subject, shall we say, of many an internet historical meme moment.
Because everyone can be beautiful
when you're made of plastic.
Ladies and gentlemen, introducing the plastics.
Oh, perfect, girlies. Oh, perfect on the game. Where's that? LABC.
You know what the doctor told me? He said that each one of my breasts are like 7 pounds.
Oh no, that's a sound. That's
I
like
got infants on my chest.
Infants.
So what size are you? I'm like a 36 triple D.
Really?
I never really heard a triple D.
Girl, they got triple Ds. I think they even
Girl, I was a
No,
seriously. My mom was an H.
Is that like, dang, why can't, what's first, H or I?
H.
Is H as big as a breast? No, you can have Z.
You know what?
What?
We is not having no Jessica Simpson moments right now. Chicken of the sea. Put that areola up too.
Oh, pop your areola away.
Was like, no, I'm not gonna just give you an implant. I'm gonna make your the size I want them to be. He made them the size he wanted
for them.
Yeah.
Well, he's dead. Somebody killed him.
Probably because he up their boobs. Dr. Dubrow better get it together, because
So there is something very alarming, and this quite happens frequently when I hear about like breast augmentation. Sometimes a person going in for breast augmentation will have a set size in mind, and a doctor will agree and then put in larger breast implants during the surgery without their permission. And sometimes the patient doesn't even know until further down the line they either need a revision or a reconstruction or to just have them removed, and then they are told that those are in fact not the size that they agreed to. Isn't that just bonkers?
We know where his office is.
Frosty Freeze know this job.
Oh dear. The ice cream killer is back.
But it happened.
I want to be perfect, girls. Right.
I hate my
Diana.
nose. I know it's a strong word,
she's
but
got-
it really is all I see.
Oh.
I have a huge family. There's 6 of us.
I keep forgetting this is called botched. Like, all of these people have had work done that is now going to either be fixed or be elucidated further, should we say. So I was just about to be like, oh my God, she's had a nose job. Like, yes, that's the point. She's on this show, Luxeria. Pay attention. Wake up.
It was really frustrating because I was born with, trouble breathing.
Oh, no.
All my sisters, everybody in my family could breathe. And I just remember constantly having to go to the doctor when I was older. My oldest sister, Dunya, had gone and gotten a rhinoplasty. And after, the first thing she said was, oh my God, I can breathe now. So then I started thinking like, well, maybe he can help me with my breathing.
Yes.
I went to the doctor and he was telling me that my only option to freely breathe out of my nose was to get a nose job. So I thought my sister's nose looks great, it works. So then I went into surgery. My face after surgery looked like I got hit by a bus. I was swollen. The whites in my eyes were starting to turn red. I couldn't even look at myself.
That is a particularly
a week later,
drastic
he took my
reaction.
cast off, and the tip of my nose was just completely raised, like a Miss Piggy nose. I feel like you can see right into my nose.
Yes,
My
a
scar
very
goes
raised
really
tip.
jagged. I think that's why it stands out so much. And on top of
deviated
everything,
septum.
nothing worked. I still couldn't breathe. About a year later, I wanted to talk to him about my results. So I called his office and he was no longer there. And nobody really knew what happened, just that his whole practice was just picked up and gone.
Oh,
I
a
always thought,
scandal,
like,
girls! A scandalous doctor on the run, girls! Oh, God, right, okay, right. Craft and commerce.
Because I like this side better because you can't see the nostril.
Yes, we know the photos.
Right.
Every photo that we have is just like that.
Favorite side. It's very frustrating to me to see that my own sisters are all really happy and they've never had to think twice about the surgery that they went through. And here
Wait,
I am,
all of the sisters have had a nose
struggling
job?
with it on a daily basis.
Because you got yours done too.
I went to a different doctor. Yeah. But
you, on the other hand, had the same doctor. Same doctor.
Yeah,
as
you
her,
had the same
and
doctor as me.
And I'm so happy. Like
Your
mine
nose
was very
looks
simple.
amazing.
And recovery for you was so different.
Remember
I was
that?
like, bam, done after a week.
If you looked at me, you could tell I had plastic surgery.
Interesting. This, if I didn't know any better, my lovelies, I would almost say this sounds a little bit like the ghost surgeons. You know, like, have you heard about this? The ghost surgeons, where like you consult with a doctor and you believe that that person is going to do your surgery, but then as you go into surgery, they like switch over and a brand new person comes in and does the surgery, but you're led to believe that you've had the surgery with that surgeon.
Scandalous. With you, like yours is so natural.
And you're making me like stare at your nose.
I know. I know.
When I saw their results, I couldn't stop looking at it and comparing it, to what I went through. And I can honestly say that I'm jealous.
Yes,
I can't believe
I'm
how
not surprised.
awful, like what all that you had to go through.
And I mean, yeah, it sucks because I look at everybody else who went to the same doctor, and that's the reason I went to him, and everybody else is so happy with their results. Going into
That's such a shame, isn't it? Because at the end of the day, we do trust professionals with plastic surgery. And the only way to judge a professional by their body of work is to look at their body of work and hear the references. And if everyone's giving them a glowing reference and gorgeous, and you're one of the people that was unlucky with that experience, it literally feels like, why? Why me?
surgery again, my biggest hopes would be to just
Oh, I
have
could go
this
for a
all
nice
go away
lunch,
and be
a
able
luncheon.
to breathe freely and be comfortable in my own skin.
Yes, and
Dr.
that's
Nassif
not
is,
an
like, the
outrageous
best of
thing
the
to
best.
request.
I mean, in Beverly Hills, everybody goes
lovely
to
hair.
him.
Yeah, I mean, I've seen him on TV and stuff.
And I've been talking about
dear,
him
yes,
for years.
Dr. Dubrow.
Dr.
Oh,
Nassif.
Dr. Nassif, right?
The name
Dr.
just
Nassif.
sounds so fancy.
Nassif is Middle Eastern too, right? Yeah.
Lebanese. Dr. Nassif actually
Lebanese.
specializes in Middle Eastern noses. He knows his people.
Ah, yes, very good. That's exactly the point. You want to go to someone who knows what you want. Very good. Always consult with more than one surgeon.
How you doing, my friend?
Good, how are you?
God, I love seeing you. You always are happy and just full of life
I'm
and
a happy
full of.
guy.
Why don't you have a
you're
little
comedic
kid?
relief to me.
I'm a happy
Actually,
guy.
maybe you can be my jester.
A court jester. Very appropriate.
I'm so excited.
Are you nervous to meet them?
Are you nervous?
Super nervous.
I love
I brought
this
my
little
younger
wave
sister
she's got
Doris
going
with me.
on.
She
Very
and I are
glamour.
best friends. We tell each other everything, and she's been there every step of the way.
Okay.
How are you, Diana?
Terry Dubrow,
Pleasure
nice
to
to
meet
meet
you.
you.
Here. What's the tea?
Diana, it's a pleasure to meet you.
Diana,
Hi. Okay.
what's happening with your nose?
About 10 years ago, I saw an ear, nose, and throat doctor, and he also specialized in plastics. And his recommendation to me was the only way I can help you breathe is if I go in and completely reconstruct your nose.
Were you displeased with the way it looked?
No, not at all.
No
I
kidding.
never once thought about plastic surgery, and I still could not breathe.
So you had zero improvement following that surgery.
Correct.
So he literally
Zero
just did a
improvement.
fully
And the
cosmetic
cosmetic.
job.
The tip of my nose was never raised before surgery.
Basically, you
correct.
went in and you came out worse.
Worse.
This is about 10 years later.
That's
what
shocking.
has taken it this long for you to get into think about doing it?
I've told my sister, one day, Dr. Nassif will fix my nose. I've been saying that for the last about 8 years.
Wait a minute,
Wow.
what?
Yeah. I first saw
Interesting.
Dr. Nassif on Dr. 90210.
Dr.
and
90210, girls.
I remember saying, this is the doctor who's going to fix my nose.
This is
His
the
work
doctor
was
for me.
amazing, and I knew that he would be my doctor someday.
Okay,
You know,
right.
I've
Well,
been to other
she saw
consultations,
someone
and I
and
never
she was
went
like,
with
come
it.
see
mine.
I've been saving up, and I finally feel comfortable with every aspect of it.
That's nice. It makes me feel good. As I was sitting there listening to that, I started sweating a little bit because now I have to make sure I help her.
Now
Let's just
the
kind of
pressure
look
is
inside
on,
your nose, see what's going
girly.
on with your breathing. You do have some allergies. See that mucus? See those little bands? That's allergies.
When they went into the right side, which I have the most difficulty breathing through, I could feel every push and every move inside.
This is just too high. This is overprojected.
Can I press one more time? I just want to see something. Yeah, that looks so much better.
So you just have to walk around with me and hold my nose
yeah,
like
you-
that.
Oh, yes, there you go. A personal
we're gonna
jester
do
nose holder.
is taking this in a little bit, but this has to lengthen.
I'm so used to the tip of my nose being so high that was always just kind of a hope that it could come down, and now I'm just counting down the days.
That scar is
Interesting.
not the prettiest scar in the world. We can improve it, but when it's been already cut on before, I can't make it perfect, but we can make it a lot better.
I avoided the
That is a really important thing to remember, is that with revision surgeries, in fact, with plastic surgery full stop, there is no such thing as perfect. And perfect in the eye of a doctor, your doctor, might be different to your idea of perfect as well. There's always room for improvement, but to actually go into a doctor and be like, I want to be perfect, which is where I have like a funny problem with like the titles of this show, because I want to be perfect is not actually helpful. If you go to a doctor and say, I want to be perfect, that doesn't actually like help anything. You need to have a realistic, calculated idea of what you would consider like best case scenario. And then you need to like get your doctor to be like as close to that as possible where you can agree on it. And you need to do this multiple times with loads of different doctors so that you can actually understand what you're happy with getting. And you know what? Even after that, sometimes mistakes can happen. But at least you get to say then that you did your utmost best to ensure the best outcome.
I want to be perfect.
I want to get going.
Good luck with your gout.
Oh, brave, in the designer fabric, brave. Mode.
And I love it.
I'm excited.
Oh, here she is.
I'm the
She's
number
shopping
one
for her
Madonna. I gotta
latest
keep that
body.
reputation. And Madonna has had a 30-year career, so it's been a non-stop challenge for me to create all these costumes, all these looks. It's got to be costumes that can come off really easily, can be put on, so just wham, bam, bam.
We're gonna do your stuff and the
Wham,
dancers.
and the dancers.
Okay, perfect.
Bam, Tony,
There was
the costume
Madonna
designer.
impersonators before me. But
What
I
is he
took it
getting?
up
A
a notch where
rhinoplasty?
I went out of my way to get surgery done to my face. I went out of my way to get exact costumes made. I mean, my costumes are like gold to me. They're like my children.
Well, you got to have RB, haven't you? Got to have RB.
Yes. This is the perfect look for borderline. I look up
What a
photos
hideous
and
fabric.
go on this endless search for the exact fabrics, the exact trims, the colors, even to the
Oh, wait,
button.
so what is happening here? Hang on. I mean, I guess this was 10 years ago. Drag was not in the mainstream at any moment. Like nowadays, if you think of Drag Race, you actually think of RuPaul's Drag Race and not Fast Cars Along Track. At least I do, anyway. So this was back in the day. Maybe they're like trying to set the scene of what a living, working drag queen actually does with most of their time, which is like shopping for costumes, shopping for fabric for costumes, having everything custom made. But I guess this is adding an extra layer of like complete bonkersness because it's not actually someone exploring their art to create something new. It's somebody exploring their art to create an imitation of someone else. Bonkers, girl!
Well, I need like black stretch satin.
In silk?
Yes.
Yeah, we have some over here.
Ooh. It's always been my dream to live in New York City, where Madonna started. And right now I'm doing a new show in New York City where I work 4 nights a week as Madonna.
So what's the difference between the shows here and the shows in New York?
Here, it's like you have to have a pretty face. But like there, you have to learn how to sing, how to dance. I mean, you really have to be a star. Before I started, there was 10 other Madonna impersonators. Now there is just 5. And I have to be perfect. I gotta keep number 1.
10 to 5,
number
girl.
1, Tony.
Right, okay.
I really just think I ruled
that
it.
fabric man did not care at all about that, did he?
I really just think I rule this. This is my kingdom. Bow down to the queen.
Well,
it takes so
I'm
much
sure Madonna
dedication.
might
I
think
mean,
that,
you know
actually.
me, Tony. I've had my work done.
Does Madonna know about Venus Delight? Is Madonna like, don't ever talk to me? Snatched.
I've given up everything to be the best. If you think I'm meticulous about my costumes, I'm meticulous about my face. This has to look, as much as this has to look, like Madonna. Why not? I already have half my face to look like her.
This is like one of those times in my life where I'm learning about someone and I cannot imagine ever existing for a minute inside their head because it's so different to how I experience the world. I don't really ever think about celebrity in this way. Like I've never thought about like, I just need to be this celebrity. I need to have everything this celebrity has. I need to even go under anesthetic to take steps to look like this celebrity. This is one of those moments where I just don't have a reference point.
Might as well keep doing it, and after the nose, hey, I want to be in the big leagues. I want Madonna's nose, and I will do anything it takes to be perfect.
Be in the big leagues.
I like the name of the store.
What?
Puts me in
Madonna
such a good
impersonators?
mood.
Was a Madonna impersonator like an actual legitimate lifelong career aspect? Am I missing that? Perfect girls.
This is just gonna relax you a little bit.
The
Do you
hacienda.
drink it all? You probably don't drink it all, do you? You do?
Surgery with lashes and lips
You're
on.
such a good girl. I didn't think
You are
that you would
naughty.
drink.
Anytime I've been for surgery, they've always said, take your eyelashes off. Do you know once someone even said, oh, you're gonna have to take that wig off. And I was like, this is my hair, madam. And she was like, oh. And I remember at that moment being like, I'm not sure I like you, actually. But she was just an assistant consultant and no one involved in my surgery. So I was like, okay, bite the bullet, get a good result.
Oh, yeah. Chardonnay, Merlot.
Oh dear, she's going under anesthetic. I don't know what the rules are on YouTube about watching people go under. I'm sure you're not allowed.
And 2
So just
Hennessy's,
imagine
okay?
it.
I'll
Oh,
still be dancing around the table.
Well, let's
oh,
go.
anesthetic. Oh, anesthetic.
Today, we're going to do 2 procedures on Saaphyri. First, we're going to pull out our old implants and replace them with smaller ones and
She
do a
has
nice tightening breast lift.
Implants?
For a tummy tuck, we're going to do a
Maybe I
hip-tip
missed that.
incision, liposuction.
I thought, from the way that people were talking about her breast tissue, for some reason I thought that this was a natural breast tissue thing. Maybe I missed that.
To tighten up her abdomen, and then remove the excess skin and stitch her back
Yes,
up with an
that's the
incision
scary part
below
about
the
tummy
bikini
tuck,
line.
is the stretch aspect.
She wants to be a full C, but you know, the truth is, if you take these implants out and lift her, she's still going to be
Probably
bigger
a
than
C.
a full C with nothing. And if you cut out breast tissue and lift her, her nipples will die.
Oh no!
Let's not do that.
We don't want any dead nipples. Right, okay, right. Surgical
Oh, she
lady.
has a ton of breast tissue.
Yeah.
I do find it
Survey
odd that they can't
says
stop talking about
300.
breast tissue.
I was disappointed they were only 300 cc's, which means that most of her large breasts are attributable to her breast tissue themselves.
I see. She has a different situation, something that we've not actually seen here on the Chanel. Her implants are actually quite modest. 300 cc's is modest. For example, I have 375 cc's in each side of high profile implant. So I have almost 100 cc's more in each breast than she does. And that's a bit like, oh, because as Dr. Dubrow's just about to discover, or just about to discuss, hopefully anyway, that means that her natural tissue is what needs to be changed and not the artificial implant. Oh dear, girls.
So let's put a 200 in. The problem with downsizing her own breast tissue is you're cutting away blood supply and reducing the areola and limiting the possibility that they'll survive.
Oh, it's
so
a
now
different
we're
surgery,
performing
isn't it,
the
really?
mastopexy, or what's known as a breast lift. We're removing the skin in a keyhole pattern that goes around the areola, off to the sides, and down all the way to the breast crease, and bring the edges together in a more upright or superior position.
Yes.
During the entire procedure, her nipples looked viable and alive. So I'm very pleased at this point. Okay,
yeah, she
so
wants them shrunk,
the
though,
breasts
doesn't
are
she?
nicely lifted. They're very symmetrical.
Okay.
This is the best size we could get.
All right, okay, all right. I actually see what he's done here. I think although the scarring is going to be a bit more intense than just a regular augmentation procedure, what he's actually created here is actually quite outstanding, I'm going to say. Of course, we haven't seen any healing just yet, and this is all going to be completely blurred for YouTube because there's no pissing way I can put breast surgery on YouTube, which is so annoying because this is technically educational. I'm not being like, oh my God.
In her anatomy, and I think she's going to be really happy.
Okay, good.
Okay,
Well,
now that we've
good.
got the breasts lifted, we're going to work on the abdomen. Okay, so first thing we're going to do is make
Is he
an
not going to do the
incision.
areola
So
shrinking
we're
then?
going to
Maybe he
suction
can't.
3 areas. Those 2 bulges above the belly button,
Oh,
and then the pubic
liposuction
area where she
girl,
has the
carve the
fullness.
turkey.
Saaphyri's
Watching liposuction, I'll never get over just how much it is like a very visceral image to see someone going like this to get rid of like lipo tissue. It's very, very drastic, and no wonder why there's so much bruising afterwards.
major things is that she wanted her incision to be low. And
A
this
low incision
indent
in the
that she
panty
has
line.
across the center of her abdomen removed.
Right.
So we're going to do that
This
by
is quite a complex
elevating
reconstruction, really, because it's not just do that. It's like do this, but also you have to think about this other thing.
the pubic hairline, which will remove that dented segment that she hates.
Right.
Saaphyri's abdominal wall on the inside was filled with scar from her previous liposuction. That adds a level of complexity to the entire operation. I think she's going to be really happy. Isn't that a good belly button,
Well,
by the
I'm-
way?
Yeah, that belly button's awesome.
Yeah.
I'm very excited to see her final results because that. Do you see that then, Flo?
You are tan. Where have you been?
I've been gone for 10 days.
My goodness, been on holiday, girl.
It was interesting.
Benidorm,
I really enjoyed going to
18
the
to
Middle East and doing
30.
facelifts and eyes and everything else. But the majority of what I'm doing in the Middle East is revision rhinoplasty. You know, Dubai was fun.
Yeah.
Some great restaurants, great food.
Dubai.
You look
Unrelatable as a trans person.
Good. It's nice to see you, because you have not looked good recently, and you look good.
But I did eat a lot of food, so did I gain weight?
Let me see. Let's see. Whoa. You need to work out. You really do.
Great day, Dr. Nassif.
Oh, Madonna's here.
Hello, darling. Hi. Nice to
I mean, the absurdity is amusing, isn't it? Of just being like, Madonna's here! And it's not Madonna. But also, let's just not laugh at the concept of drag. I don't think the concept of drag is inherently funny, but the comedy of drag can be funny.
Nice to meet you.
So is it Adam or not Adam?
Today you can call me Venus Delight.
Venus Delight.
Venus
Depina.
Delight. I wanted to give the doctors a full perspective of what I'm trying to achieve. And Venus Delight is
she's
my name
turned
as
on
the
the
Madonna
attitude.
impersonator. I heard you are the best.
Well, we try very hard.
I am the best Madonna impersonator in the world.
I don't know what it was, but I thought that was Marilyn Monroe for a second. I'm not used to seeing a lot of drag queens.
What's your favorite Madonna song?
I have to
Is that
tell you,
bad
I
or
did
good?
see Madonna twice in concert. I mean, I do like Madonna, but I will tell you something. In the 70s, I was heavily into disco. White leisure suit, the big shirts that were open all the way up, showing
Wow,
your
look at him in the 70s. What a handsome gentleman.
chest. Heavily into that.
6 years into my impersonation, that's when I started getting plastic surgeries. And as soon as I started getting the surgeries, that's when the money came in.
You never considered any of the body? No breasts. You haven't considered the breast thing.
No, darling. I'm fully comfortable with being a male.
During the day, most of the time, you dress like a male.
I dress like a male, but I'm still a queen.
So what type of procedures have you had?
Just
Okay, that was actually a very useful way of having that explained to them, because I do think sometimes people who maybe don't know anything about queer culture or LGBT culture feel like drag queens are in some way trans or trying to be women. I mean, the concept of drag itself encompasses many different facets, and one of the roots of those facets was female impersonation or even female illusion, definitely not transsexualism.
implants. Half of my face is fake.
No rhinoplasty before.
No, that is the one thing that I just am unhappy with. I don't have a Madonna nose, and I use makeup to shade the nostrils to give that illusion that real flared up nose that she has.
I wonder if they're going to say no, we're not going to give you Madonna's nose.
So it's eyeshadow trying to give you a notched nostril, which is usually what I try to fix. I think what we need to do is examine you and see what's going on with your nose.
Are they going to say no?
I have to say in my career, this
imagine
is the
going
first
to, sorry, but imagine going to a plastic surgery consultation in full drag, just being like, I would like you to look at my nose whilst it is covered in a very severe optical illusion to look completely different.
That's come to my office and said I want to look like Madonna.
You know what's interesting? Your nose actually already looks like Madonna's nose.
They're going to say no, aren't they?
Yeah, she actually, I mean just from the front, her nostrils are not pulled up.
No?
No. You have a little hump.
Yeah.
Not
But
bad
so
at
does
all.
Madonna. Your nose is like a younger version of her nose, but better.
Yeah, a younger version I can see.
Yeah.
Because as with time, her nose has fallen.
Was this just a thing to get on TV?
I have a
do you
better
think?
nose than Madonna. I mean, that was just the best compliment.
Let me see something. If we push your nose down like this, you'll look more like Madonna's nose. Do you want, this is what Madonna's nose would look like on you. That's not good.
Darling, I don't know.
Carving out normal, good skin in the nostrils to actually have them notched, that's actually doing damage to somebody. So I'm not going to do that. If you cut off tissue here and here, you'll see more black and you'll look like you had a nose job. And if you take down this hump, this area here will become wider.
If you do surgery on anyone, you take on the normal surgical risk. His nose looks so good now that we could risk going down that path where they're botched.
Interesting. Very interesting.
And if you're telling me this is going to make me look unattractive, I mean, I just can't have any of that.
Yeah.
I'm single right now. The boys would never want to talk to me if I had a nose looking like that. I just can't have that.
I think you're getting where we're coming from, which is basically leave your nose alone.
Yeah.
I
Well,
see.
I mean, I don't
So
want to go
it's
through
a
life
no.
looking like an orangutan. So at the moment, I'm content with their advice not to get the nose job, but
Is that allowed?
at the moment, I'm content with their advice not to get the nose job, but I am still young, and you never know, I might meet a rich plastic surgeon.
Let me ask you a question. How do you do that thing?
Oh, this?
If you're not going to learn from the #1 Madonna impersonator in the whole world how to Vogue, who are you going to learn from?
Ballroom.
Right hand,
what are we gonna-
left, shoulder. You're a star.
Nobody tell. Oh,
He has
so-
the white man syndrome when it comes to dancing. He doesn't have the rhythm.
Not my
I
words.
do, though.
Not my
And you're
words.
slicking down your hair.
Oh, dear.
Yes.
I own it.
UK versus the World, season 8. Beauty girls.
I'm just
Okay, so Venus Delight was Venus denied.
Ready to just be
Diana.
like done, be done with
Okay,
this.
is
I know.
this
It's just been so long. This is
going
one of
to
the biggest
be-
days of my life. All my sisters have these cute noses, and I have this huge mistake on my face.
Diana. Hi. Yeah, I'm going to be your nurse today.
Hello.
Oh my gosh, so this is it? Yeah, this is it.
Right, okay, right. Oh, I hope it. Oh, Diana. I
The biggest
hope
thing
it
that scares
works.
me today is waking up from surgery
Yeah,
looking like I
cheekbones.
did last time.
She has a hard-nosed revise.
Came to the right place.
Hey, that's what we do. For Diana's rhinoplasty, I'm going to use rib and left ear cartilage and skin to extend her tip, which will give her nostrils a more natural appearance.
Okay.
Then I'll fracture her nasal bones to help narrow and straighten her nose, and I'll open up her airway.
Okay.
All right, 15 blade, let's start. I'm gonna go ahead and open up the nose.
Drastic.
She's got something very firm in the tip of her nose. I can just feel it. All right, we're gonna leave that alone. I've just opened up the nose, and I found that the septum has a large bump on it. Most of the cartilage, though, below that has been removed, and her tip cartilage are very, very long. It's very, very hard to make a nose tip soft, pretty, functional so you can breathe. It takes finesse, and it takes a long time to heal.
Yes, yes,
Go
it does.
harder.
Oh, not the
I've
nose
just
bone. Chisel
completed
and hammer,
fracturing
girls.
the nasal bones. Now I need to add the piece of cartilage to reform this
You
whole
are
area,
paying
just to
for
make that symmetric
expertise.
and stronger. Now she's wide, though. I want to make Diana's nostrils more symmetric and smaller.
But not
since
wider.
I can't ask Diana, who's under anesthesia, I'm going to go ask her sister. You never know what you're going to get in revision surgery, so I have to be ready for everything. In this situation, I knew I had to reduce those nostrils. I do have one issue.
What's the issue?
You remember how her nose...
Imagine a doctor leaving surgery and coming to talk to you. You'd be like, and they start with, "We have one issue." You'd be like,
She's dead.
wouldn't you? I know I would.
was really tall.
Yeah.
So when you push the nose back, the nostrils will flare out, and it's asymmetric. Now, you see how this side here is a little bit wider? What I would like to do is something called alar base reductions. Make an incision from right here, right in the crease, right about up to here. And I'd have to take a little bit more on the left as compared to the right to make it softer from the front so it's not as wide. I usually tell the patient this, but your sister is sleeping, so I'm throwing this on you.
Okay.
I can leave it alone.
Is that
or
allowed?
we go in and we do this procedure. Anytime you use a knife to cut anything, you always will have a scar. So what do you think?
Pressure, girls, pressure, pressure, Diana!
What I would
getting
like
more
to do is
unhinged.
make an incision from
Okay.
right here, right in the crease, right about up to here. I usually tell the patient this, but your sister is sleeping.
Doris.
So I'm throwing this on you. So what do you think?
Doris.
I don't think that her scar could be any worse than what she has right now. And I know that she would really want it perfect. And I trust you, and I think that you can do a really good job.
I will do a great job.
Okay.
If it was just something to do with the rhinoplasty, was something I do internally, I wouldn't have to ask for permission.
Yeah.
When you have to make an external excision on the side of the face, it's always good to ask permission. I just went out and spoke to Diana's sister, and she gave me permission to make Diana's nostrils
Imagine,
smaller.
I don't think
They
I
look
would
good
let
from
my
the top.
sibling be
They
like,
look
yeah,
fantastic.
sure.
So I would
Although I
hope
don't
that
know.
Diana's happy with it.
Oh, I don't know how much of this I'm going to be able to show, but like that's a lot more of what she was asking for, I think. Right, perfect, girls.
Hi. I could be better. This week is like I'm kind of here, and I'm kind of not here. It's like a lot of laying around.
Oh, she's got it in a different colour.
And talking to people and them not understanding exactly what I'm talking about.
Yes. Oh, not fun. Cake.
Over here, they have some really good cookies sometimes. I think the first day they messed up, they had some, I don't know where they got those cookies from. But now, all the cookies have been good. Do you guys have more of these cookies?
She's still over me.
Oh, that woman is like,
cookies
don't
are like,
talk to
Eat
me.
me. Eat me. You know you want me. All right. Thank you.
She put her
I
one
was like,
more.
you right, bitch.
Oh, no.
I do want you. Come on over
A
here.
few more. Oh.
I like
Surgery,
the
girls.
cookies. The best part of coming to the doctor is eating up all their cookies. Hello, Saaphyri. We are ready for you. Okay.
This little lady, this assistant
I didn't
lady,
want to be
seems so
too
sweet.
greedy
She's
and
always
eat
like,
them all, so I just at least leave one there. But I'm gonna grab a few of those when I leave.
Cookies to go.
Hi.
Hi, Dr. Dubrow.
How are you?
I'm okay.
Yeah. How's your energy level?
I'm sleepy.
Yeah.
Yeah, I'm sleepy.
Blows you out. This much surgery. You had a all-day surgery.
Blows you out. I'm not sure about
The thing
that
I was
turn of
most
phrase.
interested in with Saaphyri is that she's had a lot of surgery involving lifting up what we call flaps of tissue, which means you're removing and impairing a
flaps
supply. I want to make sure nothing is dying. Well, that's
yeah.
pretty
We
great.
don't want any
Have you taken a look
necrosis,
at the breasts?
thank you.
They're pretty great. Wow. And you're making me look good. I like it. Because it's all about me.
Yeah, of course, of course.
Because if you don't heal
they
this
look
well,
great.
you know, I don't look good.
Yeah.
And
If you don't look good,
then we've got a problem.
yeah.
Saaphyri's one of these patients that has great spirit and will heal really well. She went into surgery really motivated. She came out of surgery in a good mood. All of her surgical sites just look very calm and happy.
There is something to be said about
really,
like
they
positive
are.
mental attitude.
My areola would have been all the way over here.
Oh, I know.
And now it's like right there. That's cute. I have tiny little nipple areolas. Oh my God, girl. You look cute. Look at your It's just like I want everything to be see-through. I want everything to be see-through
She
for
wants
at
to
least a
show it
year.
off, girls. Got it, flaunt it. Oh, she
I
seems
feel
really
my nipples
lovely.
getting hard or something, and it's cold, and that's kind of painful.
Your nipples are getting erect because
or
they're cold?
something,
That's
'cause it's
good. That
cold.
means they're alive and they're working.
true.
Oh, okay.
That is by the way, that is the best news you can give me.
Okay,
I'm so
that's
pleased because that
good.
means they're not only vascularly intact, they're neurologically intact.
Yes, the nerves
which
are
is
still working.
amazing. Give me a hug.
Thank you.
You're welcome. You're doing
Right.
great. You're really
Goodness,
doing great.
okay.
Saaphyri looks like someone who's
Still got
about
her
6
brains.
weeks out from surgery when in fact she's only 6 days out from surgery. And I attribute that to her spirituality and her great attitude and optimism.
Stop being silly. Dog! still alive? Yes, thank goodness for that. Does anybody here ever just sometimes look at their pet and go, are you breathing? Panic.
Hello.
Right, hello.
Hi.
Oh my God, look at that beautiful color.
Oh dear. Oh,
Look at
she's
the
a reactor.
Smile, happy in the morning.
She's feeling great. It's good to see you.
When people look at me, they're assuming I'm in a ton of pain, but it really doesn't feel bad at all. And I know it sounds silly because I just came out of surgery, but
That
I
is
just already feel like a huge weight has been lifted off my chest.
What do you think of your
colours? I know people don't like bruises or whatever, but look at the richness of those bruises. I love bruise tones. They're so beautiful. I don't know, just being a bit weird.
It off my chest.
What do you think of your color? What do you think about that?
I think it works with me.
She was in a wonderful mood. That's fantastic. That's what I like to hear.
And this bruising is nothing compared to last time.
Well, that's a lot of bruising.
It's a lot, but I was way worse before.
Really? Okay,
Yeah.
so you oozed a little bit. In Diana's scenario, she's not even that bruised, but to me, she's really bruised.
Yeah.
So right there, she is a bruiser. All right, and you see these little things here?
Yes.
Okay, did you guys talk about that? I just wanted permission.
Yeah, for permission, basically. She felt like it was so much pressure on her to make that decision.
Yes, 100%.
You made the right decision.
100%.
But I'm so glad you said yes. Like, thank you, thank you, thank you.
It's always gratifying when the patient says, yes, you guys made the right decision.
Yes.
You have a lot of bruising.
I do.
One thing we can do is do an IPL, intense pulse laser, and that will help cut down your bruising quite a bit. Bruising like Diana has is blood underneath the skin. So the laser will eat the blood underneath the skin.
My goodness, she has to have a laser session.
How's it feel?
Surprise.
I just feel a lot of pressure.
Laser. Ooh.
How are you doing?
Oh, goodness.
I'm okay.
Good. One side is done.
Oh, that's it? The laser felt like really tiny, like needle pricks. It was quick, so if it's gonna minimize the bruising, then it was worth it.
Wow.
Okay, you did great.
Goodness me.
We're all done.
I am so beyond anxious
She's
to have
got
my
a little
cast taken
road
off.
to
I'm just
heal
gonna be
to
counting
go.
down the days and the minutes. Thank you so much
I'm
for
always
everything.
interested because you can't really tell what's gonna happen next until the reveal. And even then the reveal still isn't healed because a nose job takes up to 2 years to fully heal. So oh, very good.
I'll see you later. All right.
She seems
All right,
pleased.
bye-bye.
Thank you.
Oh, swollen smiling. When you're really swollen and you smile. There's nothing like it, girls. Nothing like it. Nothing like it. Right, 6 weeks later.
I'm having my family
Oh, she's having a swan reveal party.
Why aren't you making it to the pageant?
Just can't wait for them to see my new nose.
Baby.
I
Right.
feel more confident because I like the way that I look. I like the way that my nose looks,
Ooh, I
the way
wonder
that my
what
face
colour that
looks.
is. Quite like
This
the
is
look
what
of that.
I thought that I should look like all along. Healing was definitely a difficult journey for me. I was pretty beat up after surgery, but it was nowhere near how bruised and swollen I was from the last surgery. It was hard to go through, but
Come on, girl,
definitely
let's
was worth
say
it.
the reveal.
She was already gorgeous
Give it
before.
to
I can't
me
imagine how
now.
much better she'll look this time.
Yeah.
Right, are you
Now
ready,
she'll
everybody?
finally be happy.
I know.
Finally,
Yeah.
right?
Way after
The pursuit of happiness. Okay, oh. Bridal plastic. Oh! Oh, wow. Oh, what a result. What a result.
Diana looks so great and so natural, and
What a
she's
result.
just beaming with confidence.
I wonder if she can breathe.
I know, doesn't it change like my whole face? It's crazy. Before seeing Dr. Nassif, the
still a
bridge
bit
of my nose
swollen.
was scooped out. My nostrils were completely different. They were really high. You could see the inner wall from either profile.
What an
And I could
incredible
not breathe out of my nose at all.
result.
And now I think that my nose is perfect. The bridge is completely straight.
Very
my nostrils are
proportionate.
circular. They're symmetrical. You can't see the inner wall if I turn to my profile. I can breathe now because my septum is finally fixed. I wanted it to look like real natural. It was, not look like I had work done. And I feel like now, like if you look at me, you can't even tell.
Yes,
No,
once all
Diana
the
has
swelling
gotten
is
one of the
gone,
best
you will
nose jobs I've
have a
ever seen.
very
It's
natural
so
result.
natural and straight, perfection.
I think Diana wins a competition now of who has the best nose in the family.
Oh dear. Oh, is it the nose job sisters? Oh. On the game. Oh, there's a stiletto. Brighton.
I can't wait to surprise my friends with my hot new body.
Ooh.
Healed up, everything looks
Is
so
this
good. I
okay?
told
This
them,
is a
"Meet me in
reveal, isn't
Beverly
it?
Hills,
Like I
ladies."
have a limo.
It's turn
We're at
time.
Beverly Hills. Reality rock star.
Beverly Hills has no idea what's coming for
Don't
them. but I have
Cabana.
arrived.
So have you seen her? I'm excited to see her, but no. I'm excited.
The limo represents long-term success stretched out success.
The doctors was really
Is that
cool.
what it's there for?
So how many doctors was it?
It was 2 doctors. One of them was fine. Okay.
Ooh, dear.
But
Dr.
let's
Whomst?
see they work.
Right, the
Where
reveal,
would
girls.
she be at? Like, really?
Joseph Martin. TCP.
Okay, it's getting late.
Come on, girlie.
I should probably try to call her.
Oh, this is very like
Look at
Jack in
your
a Box.
Hey, bitches! On, get in
Oh,
this
they
limo,
knew she was
honey.
going to be in
Let's
there. They knew it, surely.
You look amazing. Look at the girl. Look at the girl. Seeing that sunroof was open, I had to pop out. Just like Jack in the Box, but cuter. Get in the
That's
car.
what I said.
got a
That's
lot
what
to
Mummy
say.
said. Mummy.
Can't no Jack in the Box mess with this, honey. None.
Well,
So
it's her
Kylie
world,
is
and we're
here,
all just
honey, and
living
she
in
has
it,
a new
girls.
body. So she got a new body. She has a new mind, new spirit, new soul. I'm just like a new person.
So let's see them.
That's lovely. That's
I love
actually
them.
really lovely.
They are perky like they're supposed to be.
Yes. It's I'm like a 34 double D.
That's my
34
dream
double D.
size.
Okay.
Before, my breasts were superly human
Oh,
huge.
wow.
And the areola
Oh,
alone
wow. What a
was like
result.
the size of an apple. Now, they're just so model-less, so pretty, so dainty. You would think flowers were falling around me just like I was in a video or something.
Goodness.
I should be, because I'm cute.
Well, self-esteem.
My
Self-esteem
tummy look
queen.
good, look.
The indention is gone and everything.
Yes. Before, I was really, really self-conscious about my stomach
Yes.
because it looked like I had been like chopped in half.
That's
but now
wild.
my
That's
stomach is
such a good
all
result.
one level. It might be still a little poked yet because I haven't quit eating yet, but it's beautiful. Thank you for getting that weight off of me. I was like, I got your back. Let's toast to the tatas.
A toast to the Tartars. Okay, this is quite a cute little ending to the episode, actually. Oh, that's nice. Oh, wasn't that lovely? I've got some thoughts. So, my loves, I think what we've actually seen today has been an excellent peep behind the curtain into well-done revision surgery. Quite often a factor that people overlook when they go in for surgery is the idea of very good versus perfection, because perfection is kind of this abstract concept that if you're forever chasing it, you're forever sad, because there is no such thing as perfection. Any of my fellow perfectionists out there will know this. It's like perpetual disappointment. I think there's a phrase, isn't there? Perfection is the enemy of good. Something like that. There is something to really be said about picking a very good surgeon. Now, I don't know what was going on in the storyline of today's episode in terms of what happened with that surgeon. There was an ice cream scenario happening, like the ice cream killer. I think what's really important to remember when it comes to something like this is always go to more than one consultation. Don't just pick the first surgeon. Make sure you're getting a good range of opinions so that you can really understand what the best option for you is. And of course, you can still make all of the best decisions and have something that's come out less than ideal. But my loves, with that, it's time for the Patreons. You can see yourself scrolling past on the screen right here. Yes, you can. Today's Instagram shout out goes to Ghost in Bloom. Thank you so much for following me over on Instagram. You're stunning ghost on the game. If you want to be in with a chance of being featured in my next video's Instagram shout out, make sure you follow me on Instagram. It is xxluxeria. The QR code somewhere on the screen right now. Yeah. And once again, I want to say a massive thank you to my top tier Patreons. Orkos Emoji, Ariadia X, Becky Johnson, Beebles32, Cameron Pittman, Shell Herman, ContraPoints, Eric Castillo, Finch Dunham, Jen Martin, Jenny Wood, Caitlin Wright, Larissa Says Relax, Leanne Jones, Lenore, Mo Sherman, Novembrix, Paola Rivera, Ryan Loves Rory, Steffutek, Steve, and Taylor Martin. And you know what, my loves? I think I'm gonna leave it on the note of, just because somebody else has gone to a surgeon and had a great result, don't just blindly follow behind them. Always consult with more than one. And with that, my loves, I'll see you in the next one. Oh.